Is the nursing career dying? Behind the smiles, the IV poles, the medications, the scrubs, nurses are slowly burning out and they are walking out of the jobs whilst no one is talking about it. In this video, I'm going to be telling you all why this is the case. Welcome to my channel. Hi, my name is Stephanie and I'm a nurse based in the US. In this channel, I talk a lot about nursing, beauty, hygiene tips, and maybe some finance here and there. And if those are contents that you love, please do not forget to like, share, and subscribe to this channel by hitting the subscribe button so that you will be updated when new videos are uploaded. Let me tell you all, this topic is close to my heart. There are so many incredible nurses out there that are slowly walking out of the career nursing entirely and going on to another career, and I'm going to tell you all why in this video. So many nurses are leaving the bedside and no one is talking about it. There is a hush-hush about keeping it under the carpet just so that those aspiring nurses do not look like, if this career is dying, why, or is there any need for me to even go to nursing school? There are so many reasons why nurses are leaving the career, and I'm going to tell you guys why. The very first reason is unsafe ratios. Have you seen what COVID did to our hospital system? So many hospitals now are just out for the profit they make, and they don't even pay attention to how the patient ratio with the nurses are. Are they safe? How is the acuity of the patient? How demanding are the patients? Are they very rude or are they polite? Are they being nice? What are the procedures or things that need to be done on the patient? I'm going to tell you that pre-COVID, many nurses in the med-surg unit were having like 5 patients, 6 patients. But dare I say that after COVID, some nurses in some hospitals are even having 7, and dare I even say 8. Let me tell you why this is the case. When COVID came, many nurses went on to make the big money. They made 6,000, 7,000, 8,000 a week. There was that realization suddenly that, look, going back to 4,000 a month or 5,000 a month wasn't a reality, because there is more that we nurses can actually be valued. So many of the nurses now felt like, you know what, this is just too much that we are doing and we feel like we are not appreciated. There have been incidences where patients and their family or their loved ones have been very rude. They have been very uncooperative. They are not being kind to the nurses, and when these nurses report to maybe upper management, nothing is really actually done about it, because guess what, the customer is always right. So many nurses feel unappreciated. So many nurses feel like they are not being heard, their concerns are not being taken into consideration, coupled with the fact that the nurse patient ratio isn't safe. So many of these nurses have felt like, you know what, this isn't even worth it anymore, and so they feel like the next best option is to leave the hospital or the career entirely. In some states, there are unions that is going to protect the patient ratio with nurses, like California, but in some states, no one actually cares. And there I say that in some hospitals, they're out more so for the profit as opposed to the safety of the patients and the nurses. And so many nurses feel very burnt out. Imagine you have to take care of 4 very critical patients on a step-down floor. In some hospitals, there I say that some nurses even take 5. And in my very first hospital, we were taking care of 5, and when there were a shortage of nurses, sometimes we would take care of 6. And I remember there was one time that they even wanted to give us 7 each, and it was like, no, we were almost at the point of, throwing out a strike. So that was kind of halted, and then we finally were giving just our regular 6 patients. But again, on a step down unit, taking care of 5 patients, taking care of 6 patients, it's a lot on the one nurse to handle. And so the nurse ratios, the unsafe ratios, is one of the biggest reasons why so many nurses are leaving their job. The unsafe ratios can be very crazy. Imagine on the med-surg floor where you have to take care of 7 patients. How is it possible that you're going to remember 7 patients' history, 7 patients' medication, 7 patients who needs pain medicine, who needs oxygen, who needs close attention, without you even writing it down? But I can tell you that if on the step-down unit you're taking care of 4 patients, I feel like it is manageable. But if you have like 6 patients, you have to be running back and forth. It's going to be very, very draining on your body, and it can easily lead to burnout. So that is the most prominent and famous reason why most nurses are actually leaving the bedside shift career. The next thing why nurses are actually leaving their career is that there's no time for themselves. There is no time, maybe sometimes, to hydrate themselves. There's no time to even take a snack. There's no time to go use the restroom. There's no time for a me time. And then I say that there is no time for even them to take a break. So all of these things are things that you need for you to survive your 12-hour shift. And then imagine that you don't even have this time because maybe the patient acuity is very high, it's very demanding. There's family members who are, asking for all sorts of things, and then that patient ratio is just something else altogether. So all of these things just accumulate in, pushing nurses to the wall, and they're like, you know what, this is it. I can no longer handle it, because how am I expected to come for a 12-hour shift when I don't have time for myself? I cannot take a break. I can't even have time to drink water. I leave late because I have to document everything, because if you don't document it, it means that you did not do it. And if you did not do something on a patient that is critical, that is necessary, and something happens to that patient, that's who gets in trouble, you the nurse. And so all of these things can be very time consuming and can be very strenuous on the body. If you cannot have time to have your own break, then what is the essence of coming for a 12-hour shift that can maybe potentially stretch into a 13-hour shift on your own body? You need that rest. And so just the fact that we work as nurses, and sometimes you will not have that time to get a break. Some nurses are like, you know what, this is not even worth it. I think that I need to find a better option to a career. The next thing that most nurses are leaving the career entirely is there is no work-life balance. I don't know if it is the fact that they don't know how to manage their schedule properly, but I can also tell you that it is not their fault, because nursing can be very, very tedious on your own self. You get to work that 12-hour shift, because in as much as it is 12-hour shift, imagine that a nurse who lives an hour away or maybe 30 minutes away, they will have to wake up maybe an hour before the time when they have to clock in. From the time you wake up, you shower, prepare your lunch bag, your scrubs and all of that, and then you have to drive that long commute. That is already 1 hour or maybe 1 hour 30 or 1 hour 15, 20 minutes, however long it takes for you to get to your hospital. And then you have to come, you have to document, you have to take care of your patients. You have 5 patients, you are running helter-skelter, you're giving pain medicine, you're taking them for procedures, you're bringing them back, you're hooking them to the monitor, you're bringing them snacks, you're emptying Foley's, you're emptying ostomy bags, you're watching their vital signs, you're giving insulin, you're giving blood pressure medications, you have to call the provider. All of these things can be very, very tedious, can be very, very daunting. And then something happens to one of the patients, you call a react or you call a code blue, you have to be doing CPR. Guess what? CPR is going to take more energy from you, because that pressing and the compression itself, it needs you to be able to do the compression at a certain depth, and that takes energy. You have to do that compression, you have to wheel the patient to the ICU if I thought the patient needs to be taken to the ICU. Worst case scenario, the patient passes on, you have to wash the patient, you have to take them to the morgue, or you have to go drop them off, you have to come back, you have to catch up on your other patients and their needs and their demands, and then you have to drive home, maybe that 30 minutes, you get home, you have to shower, you have to check on your family, your kids, your husband. Look, this is very, very tedious. And so you have to be able to make your schedule in such a way that yes, there is a full day that you did maybe like 15 hours out of your family. You should at least make sure that you are having a full day, that you are decompressing, you're actually catching up on the energy that you expended while you were working. So the work shift balance can be very, very tedious on some people, and that is the reason why, even though some nurses might not leave the hospital entirely from doing the 12-hour shift, some of them might opt to go for a 10-hour shift, maybe in a clinic or another hospital that does 10-hour shift, and some of them might opt for an 8 hours in a hospital or a clinic. So many people are opting for different things when it comes to nursing for 12 hours that can grant them that work-life balance. So the work-life balance is also one of the things that makes so many nurses to just be like, you know what, I cannot handle work and then come back to take care of my family, and then I have appointments, I have things to attend, maybe programs to attend for my kids' school, and maybe my husband has a celebration, something, or family reunion, or maybe hospital appointment. So there is that lack of work-life balance that also makes nurses to feel like, you know what, this is not it, this is not what I thought nursing was, this is not what I thought this career was all about, and so you know what, I'm just going to quit, I'm going to find something else entirely. The next thing that makes nurses to just leave the bedside or the nursing career is that most of the time some hospitals, the management don't listen to what we the nurses want. Maybe you want supplies and you keep asking for maybe IV tubing, or you keep asking for the IV pumps are not working and nothing is being done about, and then you find yourself having to ask for other nurses for, hey, does any other person have IV pumps in their rooms, or hey, does anybody have or maybe you might have to wait for another patient's medication to finish and then you get an IV pump, or there are no chairs, or there are no computers to document, or there are no phones to scan medication. Some of these things when it comes to the supply things can really make your shift very crazy and very annoying. Another thing is maybe the patients are being very rude to you. You keep telling the management that, hey, this particular patient, yes, maybe the patient is that kind of patient that keeps coming and going, but the patient is very rude and you're telling management so that they can do something about it and they're not doing anything. Or what about the elderly nurses that are actually eating their young? There are some of these senior nurses that they tend to use their seniority over the younger nurses, and this makes the younger nurses feel very frustrated when they're coming to work. And in that case, they tend to be like, no, you know what, I'm coming to work, I don't want to have to deal with this elder nurse. And so some of these little things, when you take it to management and management is not doing anything about it, it makes your job very frustrating. It makes your job very annoying. It makes your job it just makes you feel like, you know what, this is not what I signed up for. So when management is not listening to the needs, the cries of nurses, and they're doing nothing about it, that makes nurses to feel like they're overlooked, they're underlooked, they are not being heard, and so many of them just feel like quitting all of a sudden. Some might want to find another nursing job in another hospital, or some might just be like, you know what, this is the third hospital I've worked and this is the same thing. You know what, maybe nursing is not for me because I feel like I was told this is a professional career, this is a career with so much respect, but management is not giving me the respect that I thought I should be having. And so that makes a lot of nurses very frustrated, and they just quit all of a sudden and just walk out of the career entirely. The next thing is lack of mental health support. I can tell you that hospitals are supposed to be having, educators or people that you can turn to, that you can vent or talk to, where you can decompress, and they can help you manage your emotions better when it comes to what you do at work or what you do at your job. But sometimes the hospital might not have those facilities that will help you to get that emotional and mental support that you need. Or maybe when they come, they work the 12 hours, 15-hour shift, they go home, they don't have that mental support, maybe from family, and it feels like more so you come to work, you had a tedious shift, you still go home and you still have to take care of the emotional and mental needs of your kids and your husband and maybe your parents who are at home. So the lack of mental support, I can assure you that it's one of those big things that nurses are just like, you know what, this is not even it. Because taking care of very critical patients especially can be mentally draining. I can tell you that it can be very mentally draining. And then you not having that support at work and you not having that support at home, it can all of a sudden just even drain you even more. Maybe you have a patient that is needs a lot of emotional support and you're there for them, but again you're thinking like, who is there for you? No one is there for you, but you are expected to be there for the patient. So that lack of mental support is one of those things that makes nurses just be like, you know what, I can't have this. I can tell you that I know so many nurses who are suffering from depression. I can tell you that there's so many nurses who are suffering from mental fatigue. I can tell you that there's so many nurses who are suffering from anxiety, of fatigue overload. They are suffering from stress, and all of these things is very it just has a way of messing with your mental stability. So the lack of mental support is one of the things that nurses, especially those who don't have that support, are really struggling, and they feel like, you know what, this career is not for me, and they just walk out of the door. The next thing about our nursing career is the compassion fatigue. Again, if you're working on the critical floor, you get to see these patients who are intubated, you get to see patients who are on like very high oxygen needs that, any little thing they might be intubated, and after intubation anything can happen. Or you get to see these patients whose acuity are very high, that they are medically unstable and anything can happen. Now, in as much as maybe this patient can be having very high acuity, you might have to be talking to the patient, you might have to be showing them compassion and explaining things to them and telling them that, hey, this is the situation, it can get better or it can get worse depending on how people vary in the way they respond to medications and certain medical diagnoses. And again, there is family who is asking you for so many questions. They also are pulling on from that emotional support that you have to give them. So that compassion fatigue comes in also. You have to talk to family who have just lost their loved ones. You have to be there to give them support. You have to bring them tissue. You have to cry with them. You talk with them. You sit with them. You guys try to reminisce on the good things about the patient. You just try to make the atmosphere a little bit light. All of these things can bring on compassion fatigue on nurses. I can tell you that not all nurses can be that compassionate, and so for those nurses who are not that emotionally compassionate, it can be very, very easy for them to get compassion fatigue. And so most nurses are like, you know what, I didn't sign up for nursing thinking that I was going to come and be babying family members or patients, and so they just be like, you know what, this is not for me, and so they just quit. So you have to bring a lot of compassion into the nursing career, but I can understand that for those who are not very compassionate, it can be very, very fatiguing on them. And so these are some of the reasons that nurses just stand up and walk out of the door of the nursing career. And so for all the new nurses out there, for all the nursing students, I want you guys to pay attention to all these points. If any of this is something that is triggering to you, if any of this is something that you feel like you cannot handle, you cannot be able to hold on to it and work with it in this nursing career, please, it is time for you to reconsider your career, because I can tell you that these things are always going to be there. There's no way around it. And so if you cannot handle it, please just walk out of the door of this nursing career. I know the money is very good. I know it helps to assure you of so many things that you really need and pay your bills, but hey, you also need to think about your own self, your own happiness, and are you truly happy where you are working? I want you to always remember that bedside nursing is becoming very unbearable and unlivable for so many nurses. But I can also assure you that there are so many routes or options that you can do in the nursing career that cannot have all these triggering points or cannot have all these downsides to your nursing career. You can either do remote nursing, you can do school nursing, you can do military nursing. There is just so many options or branches of nursing that you can do that might not have all or some of these points. So whilst you're considering your nursing career, please make sure that you're paying attention to your downside and your shortcomings in this nursing career. If you're one of those nurses who is suffering from any of these things, I want you to drop a comment in the comment section. Let us talk, let us chit chat. This is an option, or this is a method where you can vent out, you can talk and get some emotional and mental support from maybe your own fellow nurses. Drop your comments in the comment section. Maybe you're currently going through it, or you went through it in another hospital or in another job, or maybe it is something that pushed you out of the nursing career. You're currently in another nursing career, or you are in a different career altogether. I want us to talk. I want to know other things that nurses can do, and dare I say that other nurses can also learn of other things or other careers that they can venture into, so that they can also have a source of income if nursing is not for them. Thank you so much for staying right up to the end of this video, and if this is content that you love, subscribe, like, share, and always drop a comment in the comment section. And from me to you, I want to say thank you for staying right up to the end of this video. I'll see you all in my next one. Bye guys, and stay blessed.